Hey everybody, so this week we're going to go over dissections. All the videos online that Ms. Amatuli did are based on cat. Cat is usually what we use in this course, and your quiz is probably going to have pictures of cats on it. However, cats are expensive and minks are cheap, so that's why we gave you the option to order a mink at the beginning of the semester in order to dissect something, because the best way to learn these muscles is to get your hands dirty and do it yourself. Mink and cat are very similar, all right? They have a lot of the same muscles. However, they're slightly different from one another. So after you get through the mink, I still suggest you go and watch Ms. Amatuli's videos that are on cats, because that's probably what you're going to see on the exam. And on top of that, I would still go onto Google and look up as many of these muscles as you can through Google Images. The more of these muscles you see, the easier they are to identify. And even between the same species or individuals of the same species, muscles can look different. There's a lot of variations in muscles. All right, even though all these organisms that we're talking about have the same muscles, they might look slightly different from individual to individual. Okay, so a couple of ground rules before we get into dissecting. One, it's always good to have some sort of tray to catch the preservatives that they used to preserve the specimen. Now, the company that we uses formaldehyde in the beginning. They will fix the specimen with formaldehyde, but then they dilute it with a glycol solution. So this is not as toxic as using just straight formaldehyde. However, formaldehyde was still used, and formaldehyde can be dangerous. So make sure you have something to catch any of the juices that you use. Now, if there is a lot of juice, I would just put it back in the bag when you put the specimen back in the bag, because it's going to help preserve it even longer. Second, make sure you're wearing gloves. You don't want formaldehyde seeping through your skin, so it's always good to have gloves on. I got these from Publix for like $4. You can find them anywhere. And also, you want to wear protection for your eyes. All right, so I have goggles on, and you should probably do the same thing, because you don't want formaldehyde splashing into your eyes. That, again, could be very dangerous. All right, so just make sure you're doing everything you can to protect yourself. All right, the next thing I want to go over is the tools that you're going to use. Okay, so I just want to point out some of the tools because I'm going to be using these words pretty freely. First is scissors. All right, these are surgical scissors. Obviously, you know what scissors are. Just make sure you have some in your dissection kit. We use these a lot. Next thing I'm going to use a lot are forceps. You guys probably know them as tweezers, but their technical term is forceps. So here's your forceps. We have straight tissue forceps and we have curved forceps. We use the curved forceps a lot. All right, it's good for getting fascia and fat off of muscles. All right, sometimes we do use these to pick things up, but most of the times if we're going to use forceps, it's going to be the curved ones. All right, next we have a probe. We use probes a lot. Probes are good for pointing to things and just getting underneath stuff without damaging anything because they're not too sharp. These are known as blunt probes. All right, they're not sharp at all. So it's good for picking things up or just kind of wiggling your way underneath stuff. All right, so we have two probes. We also have sharp probes. This is good for just holding things back or pinning them somewhere. All right, so if you need to hold something back, you might be able to pin it through with a sharp probe and into another piece of tissue. We don't really use these a lot, but you know you have them. I'm just gonna keep them right there because I'm probably not gonna use them today. All right, so the last thing we have is a scalpel. All right, scalpels are extremely sharp, and we're probably not gonna use this that much in this class. You're gonna have the handle for the scalpel, and then you're gonna have a blade that's usually packaged like this because these blades are incredibly sharp. All right, so they usually put some sort of aluminum foil around it. I'm gonna leave these out. We're probably not gonna need these, but just in case, I'm gonna hold them here. Okay, so let's talk about what dissection is. All right, dissection is getting into the body and seeing the anatomy of the internal body, but trying to not damage it as much as possible. That is the goal here. We wanna see inside of this organism without damaging the organism. And it's kind of a paradox because by dissecting, we're destroying it anyways. However, we need to do this in a controlled manner. All right, so knowing that the whole goal of this is to try to get inside this animal without damaging it. Out of all the tools that we have at our disposal, which ones do you think are the least damaging that we have? All right, so this is kind of a trick question. The least damaging tool that you have to use to dissect is your fingers. We use our fingers a lot, all right? It is easy to peel things off with your fingers without damaging anything. All right, it's easy to get your finger underneath stuff without damaging anything. It's always good to use your fingers. All right, so here's the general breakdown of how we do things. All right, first we will use our fingers. If we cannot use our fingers, then we will use our blunt probe. All right, that's the second least damaging thing that we have. If we can't use the blunt probe, then we're going to use forceps. That's the next least damaging thing that we have. All right, if we can't use forceps, then we're going to use our scissors. All right, because that is the next most least damaging thing we have. And then if all else fails, if we cannot make it work with any of these tools, then we will use our scalpel. All right, and this is why I said we probably won't even need to use the scalpel in this course, because scalpels are extremely damaging. It is so easy to slice through tissue and cut anything that's underneath it. All right, so you probably do not want to use the scalpel unless all else fails. Okay, so that's the general breakdown of the tools that we're going to use in order to get through this organism. Okay, so the next thing I want to talk about is the organism itself. All right, so this is a mink. This is what you should have got if you followed that link in the Canvas site. All right, that link took you to a website that gives you a skinless mink, meaning they already skinned the mink for you. All right, so this is what it should have came in the package. Okay, so there's no skin on this mink right now. So a mink is kind of like a ferret or a weasel, they're related. So this is what it looks like without its skin. So you can already start to see some of the muscles here. But just because the skin's gone doesn't mean it's just muscle. All right, sometimes there's fascia, which is connective tissue that kind of holds muscles together and holds muscles to skin, and fat itself in the way of the muscles. So a lot of times what we're spending most of our time doing is cleaning up fat and fascia off of the mink itself. Now, again, minks are not in the same family as cats, but they do have a lot of the similar muscles. All right, even we do as humans have a lot of the similar muscles that minks and cats do. However, the muscles look different from one organism to another. They just have it. Okay, it's still there. It just looks different. Something else they do with these mink. All right, you'll notice there's an incision near the neck. All right, that's because they inject something into the jugular vein and the carotid artery in these organisms. All right, so they injected latex, a dyed latex, into these organisms to represent veins and arteries. So they injected this arteries with a pink latex to represent oxygenated blood. So blood coming from the lungs. All right, the blood has passed through the lungs, got oxygen, now it's going through the body. And they injected all the veins with a blue latex to represent deoxygenated blood, because this is blood that is coming back to the lungs that have lost all their oxygen, that already donated the oxygen to the rest of the tissue. All right, so just keep that in mind. If you see these dyes here, that's what it is. Okay, so we're gonna be working on muscles for the next 2 weeks. So this week specifically, we're gonna be working on the dorsal shoulder and back, and then the legs themselves. Then the following week, we're going to do the ventral side and the arms. Okay, so this week we're actually working on this side of the animal. So make sure you're on the dorsal side of the animal. All right, so we're going to work in this region, working on the shoulders and then the back, and then we're going to do all of the legs. Okay. Now, again, you might notice a lot of yellowness on top of the muscles. The muscles themselves are pink. All right, you should be able to see these pink muscles here. But muscles are being held together with something called fascia, which is a type of connective tissue that is used to hold muscles together. All right, and you will need to get rid of some of this fascia. Also, you're going to see fat. A lot of this yellow stuff, this really goopy yellow stuff, is fat itself. So I'm going to use my curved forceps to show you some fat. So here, you see all this yellow? That is a bunch of fat. We could pull that right off. All right, the fat comes off pretty easily. All right, this is all fat. You know it's fat because it's gloopy and you can easily pull it apart. All right, sometimes it's good to have a paper towel here too to wipe down your utensils. All right, here you can start seeing some of the muscles here. So muscles are pink typically, but you can even get more of the muscle out by pulling off some of the fascia. All right, so fascia is almost looks like spider webs. All right, if you sit here, I'm using the back side of my curved forceps. All right, I'm not using the front side, I'm using the back side because that's least damaging. If you sit here and pick off some of this fascia, you'll notice that it kind of looks like spider web. So I'm getting some of the fat here, but underneath the fat, you can see some of the fascia. And when you pull it, it might be hard to see on the camera, but when you pull it, you'll see what I mean. It almost looks like cobwebs. All right, so that is fascia. So really all we're doing is trying to get fat and fascia off these muscles. Okay, so I am doing that right now. This is a long process, but the more time you spend doing it, the cleaner the muscles look. And the cleaner the muscles are, the better chance you're gonna have good study material. All right, so really take your time with this. Now, if it doesn't come off easily, then that is probably muscle. That's when you know not to go any deeper than that. All right, here I will grab muscle here. You notice it does not come off easily. You would have to actually tear the muscle in order to get it off. However, there's still some fascia, see cobwebs, on top of this muscle. So I'm still getting those off. But if you go any deeper than that, then you're probably gonna be tearing into muscle, and that's what we want to avoid. All right, so as you do this, you're gonna see more and more pink come out. All right, that is muscle itself. So we're definitely getting to these muscles. Also, why you wanna use this side, because if you try to use the tip of the forceps, you're probably going to pinch the muscle itself and you can easily tear the muscle. All right, so here's a little bit of torn muscle right here. You can see it fraying, all right? You can see all the fraying patterns of it. So that's another way you know you got into muscle. It almost looks like pulled pork if you get into it. And that's something we want to avoid. So it's always good to use the back side of the forceps just to clean it. Okay, so you don't need to make the muscles perfect. You don't need to get all the way to the muscle itself. You just need to get deep enough where you could see the outlines of the muscle. Because really when we're dissecting muscle, that's all we're doing. We're trying to find the outsides of the muscle, and then we're gonna cut the outsides or the borders of the muscle in order to make it obvious. Once the muscle's obvious, that's good enough, all right? That is easy enough to use to study with. Now there's two layers of muscles that you will need to know here. So we're gonna start with this superficial layer. Remember, superficial means closest to the outside. So that superficial layer of muscles. And then once we're done with that, we're gonna go deeper. Okay, so one thing I wanted to show you, a technique to get some of this connective tissue off, is to take a dry paper towel and sit here and rub the muscles. So when you do this, all the connective tissue and the fat will fray up. Well, the muscle tissue really doesn't fray up that well. All right, so now all that connective tissue and fat are fraying, and it gives you something to grab onto with your forceps. And so you can carry on. All right, so as I was going through the footage, I realized the superficial shoulder muscles didn't come out that great on the camera, so I'm gonna redo them. So that's why the other part of the Mink is dissected right now, so you could ignore that. So you didn't miss anything. I just had to go back and do these muscles again. But we're gonna work on the dorsal side, superficial muscles of the shoulder. So I'm working on the right side of the Mink right now. So the head of the Mink is to the right and the tail of the Mink is to the left. Okay, so we're starting with the scapular region, specifically the superficial muscles of the scapular region. And really all we're doing here is cleaning up fat's all this yellow goopy stuff, and looking for borders of muscles. And cleaning up this fat here, I've already found the border of the first muscle that we're going to cover. Alright, so I found this border, I got it off the body, I'm still getting some of the fat off. But this is a giant flat muscle that we all have, and a lot of people like to work this muscle out. This is called your latissimus dorsi, or latissimus dorsi. And you may have been to the gym and have seen a lat pull-down machine. Well, that's the muscle it's working out. All right, it's this giant wing. Okay, so lat pull-down machine works out the latissimus dorsi. Following the latissimus dorsi up will lead you to the next muscle that we're going to cover, which is a triangular shaped muscle here. So I'm going to go ahead and get the border out. So I'm just using the scissors to get the border out here. Don't want to go too deep because this muscle is actually sitting on top of the latissimus dorsi. Just need to get low enough where I can grab it with the backside of my curved forceps, which I was able to do here. And sometimes if you just tug on it a little bit, you'll see the border comes out nice and easy. Alright, and then sometimes it doesn't, so you might have to put a little bit more work in certain areas. There we go. Alright, so this triangle here is your first of your trapezius muscles. So there's 3 in the Mink that you will need to know. You have 1, 2, and then 3 up here. Alright, the first one is called your spinal trapezius. Alright, so it ends about right here. I see the other border. So I'm just going to cut out the border there. Sometimes it helps to pull on the muscle a little bit just so you see where the border is more easily. And then just go ahead. I like to use my scissors closed and kind of just work it out. Almost like you're drawing or outlining something. Okay, so I got the border off there to this next muscle. So this next muscle is another trapezius muscle. And this one is called your acromiotrapezius. Alright, because it goes to the acromion, which is part of your scapula. So your acromion is right here, so this is where this is being attached to, where the name's coming from. So this is your acromiotrapezius. That's right in front of the spinal trapezius. Again, I just got the borders out on all sides. Alright, there's another muscle right here. It's a thin ribbon. It goes under this muscle. I got that border out. And I cleaned up some of the fascia here because this is another muscle that you will need to know. Alright, so moving forward. So spinal trapezius, acromiotrapezius. Well, then this one over here is your clavotrapezius because it goes to your clavicle on the other side. Alright, so it wraps the whole top part of the shoulder. Alright, so this is going to lead you to the first deltoid. So this is your clavotrapezius. Well, if you follow it down, it looks like it's a long muscle, but actually there's a separation around here around the shoulder that turns into a new muscle. So this is called your clavodeltoid. So clavotrapezius and clavodeltoid almost look like one muscle. It's really what side of the shoulder are you on? Are you closer to the arm or are you closer to the neck? Alright, next to the clavodeltoid, you're going to see a muscle that's deeper. And there's a lot of fat and fascia that you have to get out of the way. I had to dig this out, but here's that muscle right here. This is your acromiodeltoid. And then right behind the acromiodeltoid, you're going to see this kind of oval-shaped muscle right here. Get the border out. Alright, that is your spinodeltoid. So we have these 3 trapezius and 3 deltoids, all with the same prefix. Spino, acromio, clavo. Spino, acromio, clavo. Alright, so spinotrapezius, acromiotrapezius, clavotrapezius, spinodeltoid, acromiodeltoid, clavodeltoid. And between all of these, you have this extra muscle here that we haven't discussed yet. It's a little ribbon, and it runs underneath the clavotrapezius, as you can see here. It's running up towards the head. This is called your levator scapulae ventralis. Alright, your levator scapulae ventralis elevates your scapula. So it's right there in the name. Levator is the same root word as elevate, scapulae, because it's attached to the scapula, and ventralis because there are 2 of them. We need to know which one's more ventral. Alright, so that is all the muscles of the superficial shoulder that you will need to know. So the next we need to go deeper by cutting and reflecting at the trapezius muscles. Alright, just to show you what I'm doing next, I've reflected the spinotrapezius and the acromiotrapezius. So I'm going to reflect them this way. So I cut them by the spinal cord.
All right, so when you do that, you're going to see the scapula now. So this is your scapula. And if you hold the arms together, you can pull that scapula away from the vertebrae, and you're going to see a muscle right here in between the scapula and the vertebrae. And it almost looks like pulled pork. This is known as your rhomboides minor. All right, it's a very large muscle. It's very frayed. It looks like pulled pork. There's no other better explanation. But it's holding all the border right here of the scapula to the vertebrae. So if you pull it apart, you'll be able to see that muscle. All right, and then we can see two other muscles on top of the scapula. So if you notice right here is the scapular spine, which you should remember from bones. All right, a lot of your trapezius muscles are attached to that scapular spine. All right, so you had to pull off the trapezius from that spine. But the two muscles that are right here and right here on each side of the spine are named after the fossas that they're found in. So if you remember, this fossa that's above the spine was your supraspinous fossa. Well, this muscle that's found in that fossa is called your supraspinatus. And then on this side of the spine, we had our infraspinous fossa. So this muscle is going to be your infraspinatus. All right, so there's one more muscle that you need to see that's deeper, but I wanted to show you how I reflected the trapezius muscles before I start cutting into this in case it gets pretty ugly. But there's one more little tiny muscle down here that we need to see, so I'm going to get that out now. It's on the bottom side of the scapula. All right, just to show you, here is my scapula. Here is my rhomboides minor, which is the muscle that's attaching the scapula to the vertebrae. On this side, you can see the scapular spine right here, which makes this the supraspinatus, and this one's the infraspinatus, again named after the fossas that they're found in. And then if you come down here, you're going to see the inferior angle of the scapula. Going this way is a different rhomboid that we're not covering from the angle, going towards the vertebrae. But there's another one, a very tiny one, going from that angle this way. It's a very tiny muscle. It might be hard to see on the camera. All right, but this is your teres major. So teres major, infraspinatus, supraspinatus, and then your rhomboides minor. Okay? Okay, so that's all the ones that we're covering here. We're going to go another layer deep now. All right, so this is going to be a third layer deep. Remember, our first superficial layer were all the trapezius muscles that we reflected. Okay, so now I have cut the rhomboids. I cut them about this deep right here and reflected them this way. So here's my rhomboides minor right here. All right, this is the one attaching that to there. So I cut that and reflected it this way to see the last group of muscles that we need to find. I did have to cut a little bit of the latissimus out of the way in order to do this. All right, so first muscle you should identify is this giant muscle right here, and you can get your finger underneath it. You'll notice that this muscle is between the scapula, where my thumb is, and the rest of the body, okay? And it's very serrated, or it looks serrated. All right, that's because there's a lot of different heads on this muscle. Okay, so this muscle is also known as your boxing muscle. So this is your serratus ventralis. All right, serratus because it looks very serrated, and ventralis because it's more ventral than the serratus dorsalis, which we also have. So I'm going to show you that here in a second. But the serratus ventralis is very large, and it's known as your boxing muscle because it kind of brings your arm this way. All right, it brings your arm and scapula, pulling it forward. All right, and again, you can get your finger up underneath that. Now there is another muscle though. So here is my serratus ventralis right here. All right, remember you can get your finger up underneath it. But there's another muscle on the inside of the scapula. All right, this last muscle is also named after the fossa that it's found in. All right, so remember this fossa on this side of the scapula is your subscapular fossa. Well, the muscle in here is called your subscapularis. So the muscle that's on the inside of the scapula is subscapularis, and then you have your serratus ventralis, which is this big muscle right here. All right, so since we have a serratus ventralis, we do have a serratus dorsalis, and it's very thin. It's this little piece right here. Be very careful when you're pulling this off. It's held together really tough fascia, so you can easily rip this muscle trying to get through the fascia, because the fascia is actually tougher than the muscle itself. All right, so here's all that fascia I was trying to get off up here, all this opaque stuff. But here is the serratus dorsalis right here. And you need to reflect this downwards to see the rest of the muscles. Alright, so once you reflect the serratus dorsalis downwards, then you're going to see the rest of the muscles. You have 3 rows. You have a bottom row right here. You have a middle row right here, which is a little torn up on mine, so ignore all this right here. This is all supposed to be one muscle right there. And then you have a top row that has 2. You have a muscle here, and then another muscle starting right in front of it. Alright, this one comes to a point here, and this one starts at a point right here and comes out this way. Alright, this bottom one, that's the lowest one. This is one muscle. If you look closely, it has little fat deposits on it. This is called your iliocostalis. Ilio because it goes all the way down to your ilium and attaches at your ilium in the hip, and costalis because it goes over the ribs. Alright, so iliocostalis. Then a one above that, the middle layer, is this very long muscle. It's semi-big, it goes down this way, it goes down the whole length of the body. This is called your longissimus dorsi. Alright, longissimus dorsi. Don't get that confused with latissimus dorsi, which was this wing out here. Alright, so longissimus dorsi here. And then the top row, you have this one that comes to a point here, and then this one that starts at a point here and goes down this way. The one that's more anterior towards the head is called your splenius. Alright, so this one right here is your splenius. Well, the one behind it that starts where the splenius ends is called your spinalis dorsi. Alright, so we've covered 3 muscles now with dorsi in the name. We have spinalis dorsi, we have longissimus dorsi, and then we have latissimus dorsi, which is this big wing out here that was more superficial. Alright, so the next part of this we're going to do is we're going to come down here and we're going to look at the rest of the longissimus dorsi. Remember, that was the middle one up here. It's going down the whole length of the animal. Alright, what we want to do is cut out a window about right here. We got to get through some of this tough fascia right here and maybe even get some of the latissimus dorsi out of the way. But what we're going to do is cut out this window to see the heads of the longissimus dorsi. So how the longissimus dorsi works is that it's one muscle down here, but about right here it forks into 3 heads. You'll have one go this way, one go this way, and one go this way, all next to each other. So we want to see those 3 heads because you will have to be able to identify them, so that's why we're cutting a window down here to see that. Okay, so now I have cut a window out of some of this fascia that's in the back, and I cut some of the latissimus dorsi out of the way too, so I just cut this window. And the reason I did this is to see the heads of the longissimus dorsi. So there are 3 heads in here. There's this one, there's this one, there's this one, and then there's an extra muscle here we'll talk about in a second that's really pretty much attached to the spine. Alright, so with these heads, again, all I did was cut this window out, pulled off all the fascia until I saw the borders of the heads, and then used my scissors to cut the borders out. Alright, so with these 3 heads, you have 2 lateral and 1 medial. Alright, so the medial one is easy. It's this one right here. This head right here is the medial one because it's closest to the midline, which is going to be the spine here. And then you have 2 lateral ones off to the sides. Alright, but we need to distinguish one lateral from the other. So the one that's closest to the vertebrae, we call this the upper lateral bundle, while the lower one is your lower lateral bundle. So you have a lower lateral bundle, upper lateral bundle, and medial bundle. By bundle, we just mean heads of the longissimus dorsi. So again, longissimus dorsi is one over down on the anterior side, and as it gets more towards the posterior, it splits into these 3 heads. And then the last muscle you need to identify down here is this little tiny one, which might be hard to find the borders of because it's very tightly bound to all your vertebrae. Alright, this one is called your multifidus spinae. Multifidus just means multi-heads, has many heads, and it has a head for every vertebrae that you have, so that's where the name's coming from. So multifidus spinae is this little one, then you have your medial bundle, upper lateral bundle, and lower lateral bundle of the longissimus dorsi. Alright, so next we're going to move all the way down to the hips now and go over the muscles of the hips. Okay, so just to show you what I'm doing now, I'm still doing the same thing I have been doing, but in case you're still struggling with finding muscles and getting tissue off, my usual technique is to take paper towel, the drier the better, so once it starts getting wet I just grab another one, and I sit here and just rub the tissue until it starts fraying up. You can see how much fraying right here. Typically the muscle won't fray like that. It's really mostly fat and fascia that'll fray like that. And that will usually give me enough for me to come in and use, again, the blunt side of my curved forceps to pull those pieces off. All right, and I'm trying to get to this pink tissue right here, which is the muscle itself. Something else I want to point out too, we're going to start working on the hip here pretty soon, but there is a lot of really dense fascia up on the hip too, which is more of a white color. It's really opaque. This is more plasticky in texture. So I try to get underneath it and peel it off, but you have to be super careful because the muscle is just directly underneath it. So you want to get underneath the fascia without actually puncturing the muscle itself. And finally, the last thing I did here is use my scissors very carefully. Use my scissors and cut off the tail because we don't care about the tail. This is human anatomy physiology, so we got rid of the tail. And this just makes it easier to work down here. But be very careful doing this, especially when you get to the bone. It gets kind of hard to cut through and you don't want to cut yourself. All right. Okay, so now I did the outside hip. What I first started with was trying to find this muscle right here. It's a very large muscle and easy to find. This is called your bicep femoris. Biceps, whenever you hear the word sept and then some prefix in front of it like bi or tri or something like that, that means how many heads that muscle has. So bicep just simply means 2 heads. We also have a bicep in our arms, which a lot of people are most familiar with. But this is your bicep femoris, and femoris, giving you an idea of where it is. It covers the femur, and remember the femur is that very long bone that we have in our upper leg. So this is your bicep femoris. So the best thing you could do is find the outer edge of the bicep femoris and then get a probe in it and then keep pushing the probe until you see metallic on the other side. That's when you're going to know you found the other border of the bicep femoris. So there's the bicep femoris. Once you find the border all the way to the top, that's going to lead you to the next muscle forward. So the next muscle forward is this little thing right here. It's usually a little bigger in cats, but it's tiny here. This is called your cauda femoralis. So humans don't have this. All right, this is something you find in a lot of animals that have long tails, and it's right there in the name, cauda femoralis. Cauda meaning going from the tail, femoralis meaning going down the femur. It's a really tiny muscle right there, just in front of the bicep femoris, which is all of this. All right, and then in front of your cauda femoralis, you have your gluteus maximus, and the word maximus usually means large. Well, it's called that because it's named after us. In four-legged animals and quadrupeds, the maximus is actually pretty tiny. Alright, so this is your gluteus maximus, not very big. And then in front of it, I tore into it a little bit trying to get the fascia off, so please ignore that hole, but I'm going to outline it right here. Oops. This muscle right here, that's in front of the gluteus maximus, is the gluteus medius. Alright, so in quadrupeds, the gluteus medius is bigger than the gluteus maximus. But in humans, it's reverse. The gluteus maximus is much bigger than your gluteus medius, and that's really where the name came from, was from us. So gluteus medius, gluteus maximus, cauda femoralis, a little tiny one, and then bicep femoris right there. Underneath the gluteus medius, you're going to see this kind of weird shaped muscle right here. It's almost like a little triangle. Alright, this is called your tensor fascia lata. And tensor meaning when it tenses up, it's going to pull the fascia lata. So this is your tensor fascia lata. The fascia lata itself is all this very dense connective tissue that we have down here. I peeled most of it off. Let's see if I can find it here. Here's some right here. Very dense connective tissue that connects this tensor fascia lata to the kneecap. So you have this really dense connective tissue right here that helps pull the knee outwards whenever you have the tensor fascia lata flex. So tensor fascia lata is this weird shaped one right here. Again, attached to fascia lata, which is this dense connective tissue that should be right here. Alright, and then next to the tensor fascia lata, which is kind of this weird triangle boomerang shaped thing, we have this sartorius, which is going to lead us to the inside hip. So now I'm going to flip the Mink over and work on the inside thigh now, which this will be the first muscle that we see. But we at least got the border out on this side. Now we could use a probe and push a probe through until we see it on the other side to find the other border of this muscle. So that's what I'm going to do now. Okay, so again, I found the first border on this side of the Mink, so now I use the probe to get underneath it. And this is, the sartorius is a very sheet-like muscle right here. It's not very deep, but it is pretty wide. And I eventually did until I saw the probe pop out the other side of the muscle. And there is the entire muscle. So that's your sartorius. It's a sheet that makes up part of the inside thigh here. Once I found this border and got it out, I did the same thing with this muscle right here. This is your gracilis. Alright, so same idea. It's another sheet, just more towards the medial side of the thigh. Actually, I should say more posterior, because we got to think about this in standard anatomical position. But I probe underneath this border once I found it, and then it kept on going until I saw the probe come out the other side. And that's how I knew I found the other border. So I just did that. And again, when you're doing this, if you don't see anything shiny, that means you're still over the muscle. But if you get over fat, you should be able to see the shimmer of the metal of your probe. And you can punch her right through that. Alright, so but again, sartorius, which is this sheet right here, and gracilis. I'm going to cut the sartorius and gracilis right here at the kneecap and reflect them this way to see the next group of muscles, which are deeper right here. Okay, so I have reflected the sartorius and the gracilis out of the way. The first muscles group I want to show you is right on the front part of the thigh. So this group right here, I accidentally cut through one of them trying to get into this thing. Just be careful, don't do what I did. But if you look at it, it almost looks like a hot dog in a bun. Alright, that's probably the easiest analogy I could think of. So here's one bun, here's another bun that I cut through, and here's the hot dog in the middle. Alright, these are your quadriceps. So they're called quadriceps because you have 4 of them. You only see 3 here. Okay, so with the 3 that you see, 2 of them have vastus in the name, and those are the 2 buns. So this one is vastus lateralis, and it's more to the lateral side of the leg, so that makes sense. Well, this bun is vastus medialis. Now the hot dog itself right in the center is called your rectus femoris. Again, femoris is in the name because it's covering the femur. Rectus actually means parallel to, so rectus femoris literally stating that this muscle is parallel to the bone, which is the femur. Alright, so rectus femoris, vastus lateralis, vastus medialis. Now the 4th one you probably will not be able to see, but it's very deep in here. Alright, this is called your vastus intermedialis. It's deep to the rectus femoris. So typically if they're going to ask you a question about the rectus intermedialis on like a quiz or something, they're going to have a flag or a pointer going all the way in to your quadriceps to try to point out that muscle. Versus if they had a flag directly poking out of the rectus femoris, that's the muscle they're looking for, rectus femoris. Alright, so one more time, we have vastus lateralis, vastus medialis, rectus femoris, and vastus intermedius. That's deep. Now I'm going to go to the inside thigh. If you notice, it's hard to see here, but there's the femoral artery right here. It's actually very small in this specimen. But this is a good roadmap to guide you to the next couple of muscles. So there's going to be a triangle of 3 muscles that you need to know. And there's going to be one small muscle more to the lateral side of the femoral artery, which is this line right here. So this little tiny one, I doubt you're going to be able to see it on the camera. You might not even be able to see it on your Mink, but you should be able to see it in the videos. It is called your iliopsoas. So ilio because it's going to touch your ilium, so iliopsoas. This muscle actually runs through your abdominal cavity and starts from your vertebrae. Alright, so it starts from your vertebrae, goes through the abdominal cavity, and then eventually inserts at the ilium right here. Little tiny muscle, again, I doubt you're going to be able to see it on camera. But if you can't, or if you don't see it on your specimen, go ahead and look at it in the cat videos. Alright, and then, so that was on this side of the femoral artery. Alright, so now we're going to look towards the medial side of the femoral artery. And we're going to have 3 that make up a triangle right here. We have this one that varies in size depending on organism. Alright, then we have this one that's usually a little darker in color. And then you have this one that's usually bigger. Okay, so this first one that is directly touching the femoral artery is called your pectineus. Alright, it's a very tiny muscle. This one's actually pretty large compared to the other muscles here versus other specimens. It's usually smaller than this. But I can tell the pectineus from the abductor longus, which is the next one down, because the abductor longus usually is really dark in color. And you can see the dark color right here. So that's the middle one. And then the one below that is your abductor femoris. So those 3 are what make up what is known as the femoral triangle. So pectineus, abductor longus, and abductor femoris making up the pectoral or the femoral triangle. Okay, so finding your first hamstring. So this is one of your hamstrings right here. All right, it has a couple of heads on it, so it looks like it's multiple muscles, but it's really not. It's one big muscle. All right, this one is called your semimembranosus. And it makes up kind of the bottom part of the leg right here, and I know it's not part of the femoral triangle, so that's how I identify this one. It's on the same side as the femoral triangle, which are these three muscles, but it's below that and kind of making up the base that the triangle sits on. So that's the semimembranosus. Then if you go behind the leg, you're going to find a very thin muscle, all right there. Again, I found the border from the semimembranosus and then put a probe through to find the other end of it. This is called your semitendinosus. And if you look at it, it's thinner and it almost looks like a tendon. So that's where the name's coming from. So semitendinosus versus semimembranosus. Now you have one more muscle that makes up your hamstrings. You have the semimembranosus, semitendinosus, and the last one we already covered at the beginning, and that is your bicep femoris. So that's also part of your hamstrings. So bicep femoris, semitendinosus, semimembranosus, all making up your hamstrings. And the last thing that we need to see, we can only see if we reflect the bicep femoris itself. So I'm going to go ahead and do that now. I'm just gently going to cut the bicep femoris and reflect it. And then if you look, you'll see this white cord in here. All right, that cord right there. So that is not a muscle, but it is a structure that you should know. All right, this is the longest nerve in your body. All right, this is your sciatic nerve. And you can only see it underneath the bicep femoris, so that's why I reflected it this way. But there it is, your sciatic nerve right there. All right, so now I'm going to move to the lower part of the leg. All right, so to finish up for this week, we're doing the lower part of the leg. This can get tricky, especially with the mink. They're just really tiny and kind of get close together. But if you follow certain direction, you will be able to find all these muscles. The first muscle you should be able to find is this one that's out in front. All right, this one is covering this larger bone that kind of makes up part of your knee. So if you remember the name of the bone, this is the tibia. All right, this is muscle right here that's covering the tibia is called your tibialis anterior. All right, so I'm going to go towards the medial side of the leg first. So next to the tibialis anterior, you'll actually see the tibia itself. It's a hard bone. This is not a muscle. So that is your tibia right there. That's how I know this is the tibialis anterior. And then next to the tibia itself, you have this muscle here. This muscle is called your flexor digitorum longus. All right, flexor because it flexes something, and it says it right there in the name, flexor digitorum. Well, this muscle flexes your digits. All right, it's a long muscle that flexes your digits, so flexor digitorum longus. All right, again, right next to the tibia itself. And then we have our calf muscle, which is all this back here. This is called your gastric nemus. All right, so your gastric nemus is your calf muscle. However, you have another piece of the gastric nemus inside of here. You might be able to get it apart, you might not be, especially on the mink, they're really tiny. But you'll see this extra muscle in here. All right, this muscle is planted into the gastric nemus. You can't get around it. All right, so this muscle is called your plantaris. So plantaris is inside the gastric nemus on the medial side. All right, and then we go the other direction. All right, again, we have our tibialis anterior. That's the best starting point that we have. And then moving this way, you'll get to our first muscle, which is this one right here. All right, this one is called your extensor digitorum longus. All right, it's called your extensor digitorum longus because it extends the toes, while the flexor that's on the other side curls the toes or flexes. So flexor digitorum longus on the medial side flexes the toes, extensor digitorum longus on the lateral side extends the toes. And then we have another muscle right next to that called your fibularis. All right. Unfortunately, on this side, I tore out one of the muscles that I wanted to show you. Here's the remnants of it right there. So again, on the outside though, this is your gastric nemus, right? Gastric nemus. Well, remember on the medial side, inside the gastric nemus, we had a plantaris. Well, we have another muscle inside the gastric nemus on the lateral side. This was it right here.
that I tore called your soleus. And you can actually get a probe underneath this one. That's what I tried to do to make it easy to see, but then I ripped it doing it. But you can get a probe under this one. So how I remember is this one is flying solo, all by itself. So soleus versus the medial side where you can't get a probe underneath it is called your plantaris because it's planted in the gastrocnemius. Alright, and the last thing that you do have to identify is the tendon that all your calf muscles come to that's touching your heel. Alright, so let me get a probe underneath our calf muscles here, going all the way up. You'll notice where they stop about right here is the tendon, alright, that is attaching all these muscles to the heel. Alright, this is called your Achilles tendon. Okay, so all your calf muscles are attached to your Achilles tendon. This is a lot easier to see on a cat than it is on the mink because they have such small feet. However, if you watch the cat videos, you should easily see the Achilles tendon. Alright, so that's all the muscles that we're covering for this week. Definitely on a mink is tougher than a cat. So once you go through the mink, you have really good practice, and then go back and watch the cat videos, and it should be a lot easier to see these muscles.